Hi, and welcome to the Focus on Eye Health Expert Series. I'm Jeff Todd, President and CEO at Prevent Blindness. Joining me today on a conversation around vision impairment and mental wellness is Dr. Connie Hills, a licensed clinical psychologist. Welcome, Dr. Hills.
Thank you.
So, Dr. Hills, you have the somewhat unique perspective on this topic as someone who works as a mental health professional, but you also have a vision impairment yourself. Let's talk first about the mental health professional aspect of that. Do you think there's enough attention paid to the effects that vision loss and blindness can have on mental wellness these days?
I'm going to just right out of the gate say I think that there could be a lot more focus from mental health, psychiatry, psychology on the needs of people with vision loss. One of the things I notice is, I kind of work from the ground up. So when we think of my own field, psychologists or licensed therapists, social workers, psychiatrists even, we look at the curriculums in their graduate training programs, and often there's nothing required for them to take regarding disabilities, deafness, blindness, orthopedic limitations, et cetera, et cetera. So I think that right away, sends the message to the medical community, the psychological community, that this is an option. It's not something you should know. It's not going to be in your general practice. It's for those people over there that focus on that. And so I think that's a sore spot of, a mission in the field. And I would say that the same is true through fellowships, internships, postdoctoral, predoctoral practicums, that it's never required to know about how vision loss and blindness affect our patients. It's always an option. So if you want to take that class in the psychology of disabilities because you're interested, then you will. But it's not something that the general psychological community knows about. And then once you're licensed, again, from the ground up, you go to school, you go through your internships, you get licensed. Once you're licensed, there are continuing education credits that we are required to take to uphold our licenses, to keep them active. And there are only one or two required courses that you have to take. One is in California, it's legal and ethical, child abuse, domestic violence, and now cultural competency is rising as another requirement. But there's nothing about working with the disabled, working with people with central vision loss, hearing loss, et cetera, nothing. So again, it's that, and then that's reflected in the practice.
But from your perspective as a psychologist, what more can the medical community do to better attend to the mental health needs of patients?
I keep going back to teaching, training. What are they learning from the ground up? And I've often thought that we should have more, I would say, mandatory, rotations through various populations. And I think that the same could be true of medicine. Psychiatry is somewhat considered forgive my French, the bastard of medicine. People who study psychiatry kind of aren't real doctors. They're studying the mind and mental health. And I think that that's culturally something that needs to shift, so that psychiatry, mental health, mental wellness, people's emotional well-being is really is folded into the very beginning of medical school training, medical school internships, medical school practice, that it's just not something that gets referred out, but it's something that's actually right in the medical practice, like the ophthalmology group that has a counselor or therapist or psychologist, psychiatrist on staff or down the hall or in an elevator ride, not something that's across town and involves 4 more offices to go through. And it's just harder to access.
If a patient were to come to you who is dealing with vision loss or even the possibility of vision loss, What are some of the first things that you want them to know as you're working with them?
I think the first thing I want to say to them is um, really make sure that the relationship you have with your ophthalmologist is a good one. This is a very important relationship for us. It's one that's probably going to go with us for a long, long time. And I have seen a handful of ophthalmologists, retina specialists for my condition. And I can honestly say that some of them just do not have were not a good fit for me. And some of them were great fits for me. And it's important to have somebody that really is up on research, um, medical research, FDA approval of new medicines, what the state of the art is regarding the eye condition you have. You want them to be ahead of you, even though you're looking and researching and looking at things on your own a lot. You want to be able to have somebody who has a pretty good fund of knowledge, somebody who specializes in your disease, who sees lots and lots of patients with your disease every day. So I think that's really, really important. And then on an interpersonal level, you want to be able to have a doctor that you feel comfortable with, who can answer questions in a language and a style you understand. Um, and you have to really like them on some wavelength. You have to like them, and that's very important. And if you don't, if you've got this diagnosis and you think, oh, I have this big thing to deal with now, but this doctor isn't really my favorite, if you have the good fortune of having a second option or a second opinion in the same town within your home range, then go interview a second doctor and find somebody who is a good fit.
You mentioned it as kind of a luxury, and too often, unfortunately, that is. In the eye care space, too often people live in areas where there just are not enough eye care providers within a meaningful range for them, and so if they're looking for a second opinion, that can be challenging at times. But you're right, people need to feel comfortable, whether it's their mental health professional, primary care doctor, or their vision care provider. They need to feel comfortable, the people that are caring for them. And our systems need to do a better job of supporting that, I think.
I know that I was in a small town and it was hard because there isn't anybody else, and you're kind of stuck with this one person. And so then you have to go into another gear of how are you going to teach this doctor how to work with you, and is the doctor going to be open to that and interested in that, or
Yeah.
not. So it's a whole other set of skills and other conversation, really, that has to be done, because this is lifelong, most of these conditions.
Yeah. So, Dr. Hills, you recently joined our Prevent Blindness Mental Health Task Force. Can you tell us a little bit about that and why you volunteered?
Well, I primarily joined it because I was delighted to see that there was a group of people interested in the topic. And I was so happy to be among them. Um, I was really highly curious about, as I've lived with my own condition longer and having this background as a psychologist, I became very interested in what other practitioners were doing, and where were the counselors, where were the therapists, where were the psychologists in this field, what were they doing, how close were they to the medical communities of eye disease and eye health. um, I just was darn curious to have those conversations, to start to think about building bridges where I didn't think there were any, the bridges between the medical community, the patient community, the mental health community, and the eye health community. There were just so many missing pieces that I thought would be very, very great to talk to other people about.
Well, let's shift for a moment and talk about your experience as a patient. If you don't mind, would
Sure.
you mind sharing your diagnosis and how long you've known about your eye disease?
Hmm. Of course, yeah. I was diagnosed with adult age-related macular degeneration. about 10 years ago in a routine optometry visit. There was a question mark. I got a referral. I saw a retina specialist who confirmed I had macular degeneration, dry in both eyes. And then I went along with that with annual checkups for about 8 years until I went in for a checkup and it was noted that there was bleeding in my left eye. So that one went from dry to wet. That was about 2, 3 years ago. So I received regular eye injections to stop the bleeding. And I've been working with that for about, like I said, 3 years in two different states. So I actually was one of those patients that moved to get closer to good eye care.
How have you personally worked to maintain your mental wellness throughout that experience of both the diagnosis forward?
Probably when I got the wet macular degeneration diagnosis and had to start the injections, it was a little bit more invasive into my day-to-day life than just living with dry macular degeneration, with which millions of people do. To know they don't convert to wet. I think 90% of people who have dry macular degeneration, it just stays dry. But because mine turned wet and I've got to get these injections, the first thing I thought of was, I want to talk to other people who get eye injections regularly because I don't know one. And that's a hunt.
Mhm.
You can go online, you can try to find them online. I asked my ophthalmologist if he could put me in touch with another patient of his, because he does this all day long, who was getting injections. This was the doctor that was hard for me to work with. He said no. And then I gave him my card and I said, well, can you hand my information to one of your patients and see if they could call me because of HIPAA? And someone did. And I had a nice chat with her on the phone a couple times. And then I relocated and sought out a support group through the local Center for the Blind and the Visually Impaired. And it was a live support group. So it was further along into COVID where we could meet face to face. And I just knew intuitively, I had done this 2 other times in my life when I had a high stake stressor. And I said, I just need to be around other people who do this and live like this. And what do they do? So sure enough, I got into the support group with other people who were living with eye disease, and it was great. It was just good to be among other people who were one step ahead of me, who had been getting injections longer, people who had been blind since birth for other reasons and how they were navigating the world. Day-to-day challenges that we kind of problem solve together. And it was great. And then I moved back to San Francisco and I joined another support group. And that one was virtual. That one was online. And that was lovely too. I mean, it was just good to meet people down the street, literally, who had macular degeneration or who were getting injections, but there's no substitute for that in-person camaraderie. And they're making you lunch and you're walking back and forth to the street together and talking about the local things. And I really like that. So the support groups helped a lot. It helped a lot, just helped a lot. I also am somebody who practices meditation. I've done this for just lifelong, long time. So it really came in handy, of course. The, yoga, meditation, you don't really need a lot of visual acuity for those two activities. So those help. And I think about my future and think, okay, so if I lose my more vision, how do I want to set things up? Either in my home, my life, my relationships. I try not to do too much futuristic thinking, but I think it does help me feel less afraid that, I got this. I kind of am prepared for this next step since I was so unprepared for the first one.
I think I certainly hear that that's one of the challenges is that balance between wanting to live in the now, but also looking to the future, especially a future where there's a likelihood that you're going to lose your sight and you want to prepare, go, with low vision devices and all the things that can help you as you lose your sight, but you also want to live today and here. And I often hear there's that challenge between both of those.
Mhm.
So you also recently participated in our Aspect Patient Advocacy Program, a program where we bring together patients and stakeholders to become advocates for eye care and to learn to tell their own stories over an 8-week training program. Can you share with us your experience with that?
The Aspect program was really a great program for me at the time when I joined it. Um, I think the fact that it was an extended period of time was really nice. It wasn't just a weekend or just a Saturday or 2 Tuesdays. It went on for a series of months. And I really liked that. It gave me a lot of space in between meetings to think about things and have my own personal shifting of thoughts and feelings about things. And then I could go back to this community. And the community was the Aspect, the participants were wonderful.
Mm.
They were um, interesting and lively, and there were medical professionals, and there were lay professionals, and there were educators, and I mean the range of people in there was fabulous. And um, because I had, living with the wet macular degeneration and getting the injections and noticing the vision changes was a new world to me. It was kind of like a new island. It felt like the Aspect community, I found a home. I found a tribe of people that live like me.
Mhm.
And so that really was I think what I would say as a psychologist, internalized. So I didn't feel so alone anymore. And it's just made more and more good relationships continue, some local, some national. Um, and I've recommended it to at least three people have asked for information about it because they hadn't heard about it. And I think it's a great resource for us.
That's one of the things we hear about it is that it really does help connect people in meaningful ways and across vision conditions. As you know, people with the whole variety of vision conditions are involved in that program, but they share a commonality of an understanding of vision loss and what that might mean. For anyone who is interested in learning more about that program or for signing up, they can do so at our website, preventblindness.org/aspect. Um, so as we wrap up, Dr. Hills, is there anything specifically that you would, or generally that you would like to say as a patient and a mental health professional to those who are currently experiencing vision loss?
Boy, there's so much, right? I mean, what's the kind of the kernel of it all is don't be afraid to talk about it. Even with your loved ones, you might not tell them what your interior life is like with this, and to go ahead and talk to people you love and trust about it, and you know go for a walk together, go out in the night together, and let them see what your world is like, because you really don't know unless you're up close and personal to someone what it's like. And I think that's been a really important thing for me, to choose who to let in and then let them in. I mean, if this is the future, then I want to know who's on board and who's not so on board. And I think the other thing that's very important for me as somebody who studies Buddhism is that we're all we're all going to lose some sense. We're all going to lose, this body is going to dissolve for all of us. And um for me, the vision is the most, oh, the strongest, the most amount of proof of that. But this is not a big scientific mystery from the Buddhist perspective. We're all gonna leave the planet. And so that helps me immensely because it normalizes my condition and it allows me to slide right back into the here and now. Like you were saying earlier, some patients tell you this, that you don't want to trip on the future too much. It's really, really challenging to stay right now in the here and now. And that's been very valuable to me, to do that any way you can, whether you're a meditator, whether you're a knitter, whether you're a gardener, skier, whatever you do to stay present is important.
Well, I think what you said really struck home to me was normalizing it.
Mhm.
That we all have various conditions and that we're living with, but it's all part of the human condition.
Mhm.
And just normalize what you're going through and not make it something that, is impacting you for whatever reason. It's part of living. So I appreciate you mentioning
And
that.
that's something that is not the first thing to say to somebody who's been diagnosed.
Right, right. Yeah.
But it is something that you can offer them when they, when their coping skills are beginning to rise.
Well, and to some degree, that's something that they kind of have to find out on their own,
Mhm. Mhm.
through their own experiences. But I do think upon one thing that we need to do a better job of is encourage people to seek help, whether that's, we always talk about the physical health and go see your eye doctor, but encourage them to seek help for all the conditions that they're experiencing, whether that's mental health, vision health, for their diabetes conditions, if they have diabetes, and to seek that out, because we don't always do the best job to tell patients to do that. So it's important for them to seek that out.
And to somehow see that that's actually a strength. Because if you're asking for help and you're getting resources to live independently and see better and feel better, that's a strength.
Yeah,
But it doesn't always get framed that way at the beginning.
yeah. Well, I've really enjoyed having this conversation, and we talked real quick about the mental health task force. I know that the task force is putting out a guidance paper that we'll have published on the Prevent Blindness website relatively soon, along with some follow-up information. So I encourage everyone to visit preventblindness.org. And once again, Dr. Hills, thank you for taking the time today.
My pleasure. Thank you.